Good afternoon to all the participants. My name is Lara Costa Silva and I am a physiotherapist, and I will be with you for the next 10 minutes presenting the results of our study about sports injury in Portuguese youth and maturation. The presentation will begin with the contextualization of the thematic, the purpose of the study, and the methodology used for achieving that same purpose. After that, we will then present and describe the results obtained, their discussion, and the main conclusions. As we all know, physical activity is beneficial, promoting healthy development in children and adolescents. However, in this age group, occurs in a variety of injuries while playing these sports and activities. Growth spurt, maturity-associated variation, and lack of complex motor skills needed for certain sports are among the risk factors that may play an important role in the growing athlete. Enhanced environment for injury can occur, and several authors reported structural and tissue change that may contribute to this situation. As children and adolescents participate in sports in record numbers, targeting risk group is important. So, our aim was to determine the influence of maturation on sports injury profile in Portuguese children and adolescents. For that, we work with a sample of 651 Portuguese children and adolescents of both sexes from 10 to 18 years, involved in different groups of sports participation, attending 4 major schools. The study was authorized by the Ethical Committee of the Human Kinetics faculty and was performed according to the Helsinki Declaration. Subjects and legal guardians gave the informed consent. We collect information about injuries with LESADO questionnaire that provided a clear definition of injury, a time frame of 6 months, as recommended in the literature, appropriate terminology for children and adolescents, and all the questionnaires were distributed by the evaluator who followed and clarified all doubts in filling. Data about physical activity level was also obtained with the questionnaire, RAPIL II, using physical activity intensity levels proposed by Ainsworth. Biological age was assessed with 2 methodologies, bone age and maturity offset protocol. Bone age was calculated with the Tanner-Whitehouse III method. Left-hand wrist X-rays were taken with a portable X-ray device operating with low level of radiation. Maturity ratings were performed by one trained examiner without knowledge of the chronological age of the subjects. Maturity offset protocol determined the time before or after peak height velocity and was assessed through Mirwald protocol. Maturity offset minus chronological age provides an estimate of the age of the peak height velocity. The participants were classified for years before and after peak height velocity. For the statistics, we use Univariate analysis to identify the candidate predictors for regression analysis that were used to determine significant predictors of injury occurrence, injury rate, injury type, and body area injury location. The results were considered significant for a p-value inferior to 0.205. So we had a sample of 651 subjects aged between 10 to 18 years. 340 were boys, 307 were girls. A total of 247 subjects reported a sports injury during the previous 6 months. The average injury rate was 11.8 for 1,000 exposure hours. Regarding predictors for girls, the probability of injury increased approximately 2 times in girls who had already passed peak height velocity. Also, early mature girls with higher bone age and close to peak height velocity showed a higher injury rate. And as maturity offset decreased, a chance of girls having a strain or a fracture increased 2 times, meaning that girls near peak height velocity had 2 times more chances of having a fracture or a strain. For the boys, the probability of injury to the upper limbs was higher before peak height velocity, and in the lower limbs was higher after peak height velocity. So, girls near peak height velocity may be particularly vulnerable to sports injury risk due to the physiological process of growth. An increase in traumatic injuries has been reported mainly during the year of peak height velocity due to abnormal movement mechanics during the year of maximal growth that combines with imbalance between strength and flexibility, joint stiffness, and decreased bone density that are present at this stage. And an increase in overuse injuries persists in the year after peak height velocity. Muscles, tendons, and apophyses adapt slowly to the longitudinal growth. They only reach their full length 6 months later. If activities are performed repetitively, those tissues are not immediately able to deal and cope with the increased biomechanical stress. For boys, body area injury location is significantly different before and after peak height velocity. Before peak height velocity, boys are more likely to have fractures in the upper limbs. There is decreased bone density at that stage, and they are associated with traumatic injuries due to a transient decrease in coordination, balance, and complex motor skills. On the other hand, after P8 velocity, boys are more likely to have overuse injuries in the lower limbs. Increased stress occurs as a change in the length, mass, and moment of inertia of the extremities take place with growth. So, our main conclusions were that some injury risk factors are unique to the growing athlete and reflect all the change imposed by the maturation process and adaptation of the structures and the tissue to the longitudinal growth. Sports injury profile in youth was significantly influenced by maturation as seen. Distance to peak height velocity was a significant predictor of injury patterns in children and adolescents of both sexes. But early mature girls near peak height velocity may be particularly vulnerable to sport injury. And our last conclusion is that in a sportive context, the assessment of maturation should be strongly recommended at these stages. Thank you so much for your attention. These were the references used. This study was funded by the FCT. And thank you once more for your attention.